Hi, this is Dr. Daniel Neides, and I am here to welcome you, the group of investors who have gathered today to hear about an exciting collaboration between Nestle USA and the Cleveland Clinic. By putting our great minds together, we have developed the Nestle Go Healthy Foods line of prepared foods, and this is our home delivery model. The intent is to provide quick and easy healthy alternatives to the current processed food model that is available in the United States so that we can really tackle the chronic disease epidemic that has afflicted the United States of America. Are we really America the Beautiful? Oversized foods and oversized people has become the norm in the United States over the last several decades. This has led to a tremendous increase in diabetes. Here you see a gentleman who's missing limbs from poorly controlled diabetes. And here's evidence of coronary artery disease, as you can see from an angiogram of a patient who is afflicted with a chronic inflammatory process known as heart disease. If we can gather our great minds together between the world leader in food development with a world leader in healthcare delivery, then we have a fighting chance to help bend the cost curve as it relates to chronic disease management. According to a new report from the American Diabetes Association, an estimated 23 million people were living with type 1 or type 2 diabetes in 2012, which is up from 17 million people in 2007. In terms of obesity, there were 24 million children ages 2 to 19 who were either overweight or obese, 33% of boys and 30% of girls. Here is our opportunity to really attempt to bend the cost curve. As you look at this slide, you can see that the national health expenditure in the United States as a percentage of GDP has increased dramatically from 1960 to 2012. In 1960, we were about 5% of our gross domestic product that was spent on healthcare. And in 2012, that was 17.2%. Where are we headed? You could see that there is an erupting volcano as it relates to healthcare expenditure. And essentially, if we don't tackle the chronic disease epidemic, we are simply burning our own money. If we look at the red line, this is a curve that's based on the growth rate of healthcare expenditure as a percentage of GDP from 1990 to 2010. As you can see, by 2080, the U.S. healthcare expenditure would be 60% of its gross domestic product, which is absolutely unsustainable. But even if you take into account the Center for Medicare and Medicaid Services growth forecast, we are expected to spend by 2020 over 20% of healthcare dollars will be as a percentage of our GDP. And by 2030, that will be over 25%. Again, unsustainable if we don't reverse the current trend of how we manage chronic diseases. In an attempt to become part of the solution rather than continuing to be part of the problem, Nestle USA and Cleveland Clinic have decided to form a partnership in wellness. This is more than just healthy eating. This is also getting people to exercise on a daily basis, as well as tackling the chronic problem of stress management. Cleveland Clinic Go Healthy Foods and Nestle USA have a significant opportunity to help patients in their quest to better manage their chronic disease or help those patients who are well stay healthy. For the busy consumer who is looking for processed foods that are a healthy alternative, Nestle USA and Cleveland Clinic will be developing processed foods that will be easy to make and will certainly assist the working mother or working father who has very little time for meal preparation to offer healthy alternatives to themselves and to their family. These food items are based on the Go Healthy Cleveland Clinic criteria, which, again, as science has shown, helps in the quest for an anti-inflammatory diet. By decreasing inflammation, we can significantly impact those chronic diseases that are typically related to inflammation, like heart disease, diabetes, high blood pressure, and high cholesterol. These criteria include less than 4 grams of saturated fat, less than 4 grams of added sugars, less than 600 milligrams of sodium, absolutely no trans fat, and only 100% whole grains. The initial investment that we're asking for is actually quite small. For about $6 million, we will be able to develop 6 to 8 meals that patients then can have delivered to their homes for lunches and dinners specifically. Nestle already has the infrastructure at their plant in Solon, Ohio. They have the employees and they have the ingredients. So our startup costs will be low. But you can see, based on the population across the United States that can be impacted by these foods, which we believe will help aid in disease reversal, will have swift uptake. And so by the end of year 5, we expect both Cleveland Clinic and Nestle, the partnership, to have about $176 million in cash and $182 million in total assets. Again, with very little startup from you, the investors. There are essentially 4 groups of people across the United States that we view as our key demographics. Those groups include healthy eaters, those patients who are obese or morbidly obese, patients who have been diagnosed with cardiovascular disease, and obese children. The potential customer count is well over 150 million. And if we are very conservative in our share of market, which is anywhere from 1 to 3%, we believe by offering volume discounts when patients buy in 1, 2, or 4-week increments, that after a 3-year period of time, we have the potential to sell over 63.5 million units. Let's look at our current competitors. Well, Nestle is a competitor and would be a competitor unto itself. Nestle currently provides Lean Cuisine, Lean Pockets, Spa Cuisine, and Honestly Good. The advantage to Nestle in these products is that not only are they the largest food manufacturer and distributor in the world, but they spend more in marketing dollars compared to their competitors. The Nestle Red Box still has significant brand loyalty, and so getting patients to switch from known Nestle products to a new entity could prove difficult. What are some of the challenges? Currently, patients view processed foods, even if they're low calorie and low fat, as somehow being deemed as unhealthy and are looking for more natural or organic foods. So this will be a challenge to overcome. Heinz has 23% of the market share, and their products are Weight Watchers Smart Ones. Again, the competitive advantage is anybody who's participating in Weight Watchers may have a brand loyalty to the program. The current challenges are the same as noted above, which is anything processed in this day and age may be deemed as unhealthy, and as patients look for more natural or organic products. Conagra is 18% of the market share. Those products are the Healthy Choice frozen food line, and their advantage is that they're basically using ingredients from other product lines that are just vertically incorporated into Healthy Choice. And again, challenge is that patients are looking for natural and organic foods and are getting away from processed foods. We know that there is inherent risk associated with developing a food line that is very aggressive in limiting fat, salt, and sugar. If you ask the chefs who develop the foods, the big question is how do you keep food moist without adding fat? How do you give it good taste by limiting sugar? And how do you keep it savory by limiting salt? It will take about 12 to 18 months to develop these products so that we can offer great tasting foods that limit the key ingredients, which again leads to an anti-inflammatory diet and reduces the risk of either developing a chronic disease or better managing your chronic disease. We need dietitian and physician referrals into the program. Many cardiologists already doubt that diet can help reverse heart disease. Primary care physicians may be looking for ways to augment medical management, but may not necessarily be looking for a frozen food line to do that. Again, it's going to be very important that we partner with dietitians and physicians in order to increase sales. Patients already have an expectation as far as what the cost is for processed frozen foods. We recognize that we have to be within at least 50 cents to $1.50 of Weight Watchers' Healthy Choice and Lean Cuisine. But we also know that consumers will expect a little higher price point if we're going to claim that a processed food helps in disease reversal. And finally, what will be the uptake of children? We know that children are looking for a very specific taste, and so if we're not delivering based on too low fat, sugar, and salt, they will reject it outright. There may be some rejection by children also because of the stigma associated with a healthy product. We intend to have a threefold marketing campaign. Recognizing that consumers often look to experts like Dr. Oz and Dr. Roizen for advice, we intend to capture those patients through marketing on the Dr. Oz show. Dr. Roizen, who is the Chief Wellness Officer of the Cleveland Clinic, appears on the Dr. Oz show at least once a month. We intend to have 30-minute infomercials explaining the benefits of the Nestle Go Healthy Foods, and also advertising in print newspapers and magazines will also be critical. We intend to survey primary care physicians and dietitians employed at Cleveland Clinic to get their understanding of how healthy foods can impact disease reversal. We intend to work with 2 to 3 providers initially at several of the family health centers across the Cleveland Clinic. And this will allow us to have a sample product available. We'll have a frequently asked question handout and coupons that physicians can provide to their patients who are interested in buying the home delivery of Go Healthy Foods. By offering a partnership with Federal Express and UPS, we will be able to address the convenience factor by having these healthy foods delivered right to the patient's door. The key principles involved in the Nestle Cleveland Clinic partnership include Frank Higgins, who is the president and CEO of Nestle USA Prepared Foods, Dr. Daniel Neides, who is the chief operating officer and medical director of the Cleveland Clinic Wellness Institute. He is a board-certified family physician who has practiced at the Cleveland Clinic for the last 18 years. Roz O'Hearn serves as Director of Communications and Brand Affairs for Nestle USA, supporting leading brands Stouffer's Red Box and Lean Cuisine. Joe Sweet is the Director of Operations and Business Development of Cleveland Clinic's Wellness Enterprise. Kristen Kirkpatrick is a manager of Wellness Nutrition Services at Cleveland Clinic's Wellness Institute and is an experienced presenter, award-winning dietitian, and author who makes a regular appearance on the Dr. Oz Show. The Huffington Post named Kristen one of the 25 diet and nutrition experts you need to follow on Twitter. And finally, executive chef James Perko, who has spent over 30 years of his career in culinary medicine, and again, a featured guest on the Dr. Oz Show on a regular basis. Nestle USA has around 400 community projects running in over 90 countries around the world. Much of their support is dedicated to improving sanitation as well as drinking water to those citizens who are impoverished and living in third world countries like Africa. They are also working with Red Cross and Red Crescent societies to help combat both the malaria and HIV and AIDS epidemic. Looking at our 5-year financial statement, we are looking to optimize our revenues starting at $44 million in year 1 up to $118 million in year 5. By keeping expenses low, we expect our net income to grow from $15 million in year 1 to $40 million in year 5. Approximately 2,500 years ago, Hippocrates said, "Let food be thy medicine and medicine be thy food." This partnership between Nestle USA and the Cleveland Clinic and its Go Healthy brand of foods will help patients in their quest to lead healthier lives, reduce the affliction from chronic disease, and help those patients who want to stay well lead healthy and prosperous lives. I thank you, the investors, for listening, and hope you will invest in the Go Healthy Nestle USA brand of foods.